A majority of voters, majority, vast majority actually, a huge majority, now support Medicare for All, at least when it comes to covering this crisis. So let me show you this data that was put out by Data for Progress. Sean McElvey tweets out, voters overwhelmingly, 76% to 13%, support Medicare covering all coronavirus-related testing, treatment, and vaccination. Taking a look at the graph here, you can see how much people want this, and not just Democrats. So the top line, all voters, 49% are strongly support. Let me see if I can get this a little bigger. So here we go. Top line, 49% strongly support Medicare for All. When it comes to Democrats, 64%. So I should say 49 are strongly support, 27 somewhat support. So overall support, 76% when it comes to all voters, as I just showed you. Democrats, 64, 24. So 88% of Democrats supporting Medicare for All. Independent voters, 37, 26. So 63%, which actually honestly kind of surprised me that it's lower than Republican voters at 69%. Why the hell doesn't Joe Biden support Medicare for All right now? I'll tell you why. It's because they don't care about winning. They care about maintaining the current power structure. So, and when I say they, I'm talking about Democratic leadership, Democratic consultants, Democratic big donors. What they care most about is ensuring they keep power. So if they give in right now and support Medicare for All, they're cutting themselves off from private health insurance industry interests. They're cutting themselves off from that money. They're not going to support Medicare for All. The only way the Democratic Party will ever support Medicare for All is if you replace the leadership. Otherwise, they will continue fighting for, at most, a public option, which keeps the private insurance companies happy, keeps the private interests happy, while at the same time giving the illusion that it's going to help people. But in reality, as I've covered before, maybe I'll link to this video above later. When it comes to a public option, it would actually drain the public system of resources because of how the health insurance industry would utilize it. So the health insurance industry could simply offset all the sick people, all the older people onto the public system, drain that system of resources, and retain all the healthy people. And then they can turn around and say, look at that. Medicare for All is not going to work because a public option didn't work, even though a public option would operate in a completely different way than a single-payer Medicare for All system. Under a single-payer Medicare for All system, everybody pays into the same system. The wealthiest people, your Congress people, all pay into the same system as you. All have the same healthcare plan. Complete freedom of choice when it comes to doctors, providers, because you're all paying into the same system. So, for example, in Canada, where I live, I can go to any walk-in clinic, see a doctor, get help. There's no in-network, out-of-network, because it's a single-payer system. You're all on the same system. I have actual freedom of choice. I never think about money ever when it comes to seeing a doctor. I had surgery. Again, free. Got surgery, came home. Like, that's what a single-payer system is. You never think about healthcare until you need it. And when you need it, you get it. And the main difference here when it comes to the private system in America versus these systems, these universal systems or a single-payer system, is that in a private system, what is prioritized is wealth. So if you're incredibly wealthy, look, I'm never going to argue that wealthy people in America have bad healthcare. No. If you're wealthy in America, you have great healthcare. But if you are everybody else, you don't. Whereas in the single-payer systems, what they prioritize is need. So if you need help immediately, you get it. Say you go to the hospital, life or death, you need help. There's no asking about, do you have insurance? None of that crap. You get help immediately. Same with surgery. If you need life or death surgery, you get it immediately. The surgery that I had was elective surgery, so I could wait 3 months. I waited 3 months, got the surgery. That's why whenever you hear people, Canadians come down to America all the time to get healthcare. Those Canadians are wealthy Canadians getting elective surgeries. That's what they are, because maybe somebody wealthy in Canada didn't want to wait 3 months for a knee replacement. So they went down to the US and got it instead, and they got it immediately. Because again, the healthcare system in the US prioritizes the wealthy. So there is no argument against a Medicare-For-All system. There's no argument when it comes to the logistics of it. No argument when it comes to how it operates, how it helps people, and also no argument when it comes to the support that it has. There are countless policies that pass that don't have a majority or even close to a majority of support from Americans. But for whatever reason, whenever you see Medicare for All discussed in the press, they always talk about, oh, most Americans don't support that yet. Most Americans don't support most of what the government does. You keep passing that crap, but when it comes to a Medicare for All system, there's no excuse now. A majority of Americans do support it, and it's the only healthcare system that makes sense. Yet they will continue to fight it, including the Democratic Party. Joe Biden will continue to fight it because they want to ensure the current interests in the Democratic Party are kept intact, and they will never challenge it. They will never take it apart. They will never have a Medicare for All system until you replace the leadership of the Democratic Party to leaders that actually work in the best interests of people over profits. There's like a million arguments I didn't even make that I could have made, because they're just, again, healthcare is like talking about the general. It's just, there's endless arguments to make. I didn't bring up the 500,000 people a year that go bankrupt in the US over healthcare costs. The 45,000 to 68,000 people a year that die in America due to a lack of access to healthcare because they don't have health insurance. It's just a crazy system.